Hi and welcome to my channel. I'm Dr. Marcus Spry. I'm a dentist in the UK and I post a new dental related video every Monday. So if you'd like to subscribe and hit that bell, ding, be grateful and you will have first view of the new video. Thank you. Today's video, whoops, I've got my model out, so there must be something serious going on, and we're going to be looking to see actually what dentists do when we do a filling. What on earth goes on? And we'll have some little detail of that actually going down, just in the model though, eh? Okay. Right, let's have a look at the technical aspects today of filling a cavity. This is obviously a model of some teeth, and that dark patch there is some decay. So we're going to remove the decay because we can't just fill over the top. It's a little bit like rust. You've got to remove it before you can repair your car. And it's the same is true here. This is a dental drill, and so we're going to remove that little bit of decay there, and it'll make a bit of a noise, and I know it makes people feel a bit squeamish. There's some water that comes out of here which basically cools the drill, so this goes round and we would make a little hole and get rid of, as you can see, we now have no decay in the tooth. Alright. So that has got rid of the sort of infection of the decay. Alrighty, so that's ready now to fill. So we use this one here which dries the tooth. Sorry, I'll put that to one side. So dry the tooth there. Okay, and you can see it's all nice and ivory white and ready to go. And we use an adhesive material to stick the filling in. I'm going to use a white filling material, which is the only one I think really that's safe. And so we put some of the glue into the hole with this applicator. Now most of the materials that dentists use are, I'm going to thin it out now so that there's not an excess of glue. Most of the materials that dentists use nowadays are light cured. They're set by shining a light at it. So we use this shield so that it's not too bright for our eyes. And this is a glass rod which is conducting a blue light into the center there. And that now will have set the glue. This is the filling material in this little compule here, and so this is self-leveling material, so we put it in and it will just literally just fill up the tooth. And I'm going to use the edge of the tip there just to draw the material to the edges of the cavity, make sure it's completely properly filled. Okay. That's that bit done. That's still soft, so we would come back in with the light. The light would go in, so I'll shield that again. So that's going to now set that. So it will go from being a soft material which will have adopted the shape of the cavity to being a solid material which will be suitable for chewing on. If I take a probe now, you can see that that is completely solid and filled. The dentist would now have to contour that and polish it so that it was correct in the bite. You can imagine the jaw closing against the upper arch here, but that is a solid filling, done and dusted. So how can we be sure that that's going to be nice and comfortable? Well, the dentist would have put some anaesthetic jelly here and then would have put a local anaesthetic injection in so that this tooth was completely, profoundly numb, and you wouldn't feel any discomfort with that. Unfortunately, when that wears off, the tooth can be a bit reactive to hot and cold for a day or two, but generally that goes, and if it wasn't to go, then you'd go back to see your dentist and have some more treatment. But about 99% of the time it settles down and all's good as new, and as you can see it looks a hell of a lot better than if you had a cavity in it. So 1 down, 3 to go, and I'll be doing the rest when you're not looking at this video. So remember, go to the dentist, don't eat too much sugar, clean your teeth, for Smile for Life. Thank you. Thanks for listening. Please like, share and subscribe. Click on these boxes for more of my videos for a Smile for Life.